Hello friend, welcome to the channel Pharmacy Dictionary. In today's lecture video, we are going to discuss about the different route of drug administration with reference to their advantage and disadvantage. This topic is going to be one of the most important topic for your semester as well as for your different types of competition point of view. So please pay attention on this video and allow me to start the topic. To make the lecture very easy and easy to understand, we have bifurcated this table into three main categories. The first one will be the route of drug administration, second one will be their advantage, and the third one will be their disadvantage, or we can say the limitation of that particular drug. Advantage means all those benefits which we can get from that particular route of administration, and the limitation or disadvantage stand for those causes which limit the use of that particular route of drug administration. So let's start the route of administration from one of the simplest yet most important route of administration, that is oral route of drug administration. What do we understand by this route? In usual life, we used to eat so many food via our oral cavity, mouth, that means. So the same principle can be applied with the route of drug administration, that is related with the oral route actually. Whenever we take any medicine or any form via the mouth or oral cavity, that is considered as an oral route of drug administration. Like we have taken tablet, capsule, syrup or some kind of solution via oral route of. And what are the basic advantage? There are so many advantage for this oral route and we cannot enlist all of them, so I have placed few of them. These are safest and most common. The route of administration may be variable, may be normal, may be abnormal. Some of them require professional skill and some are does not require that. And oral route is that one of the drug administration route which does not require any sophisticated skill. Like intravenous, intramuscular drug administration need professional, but oral route does not require any professional practice. You, me or anyone can take it easily, or even a child who is having knowledge to how to eat food can take it easily or accept this easily. And this is the most common. Everyone, almost 100% people can take this route of drug administration except those who are unconscious or who are continuously vomiting out. So except for this paper, everyone can use this route of drug administration. This is convenient. That means I can use this tablet without any problem, without any difficulty or without any discomfort. This can be easily taken out by any of the age group. Second one, economical. Mostly we have seen that tablet, capsule, syrup are economic. The cost is affordable, but that does not mean that all oral route of drug administration are economic. That may be variable as per drug to drug, but mostly in an average ratio, we can say all the oral route of drug administration drug are economical and can be taken without specific training. As I have explained earlier, no need to take any training or any experience certificate for the taking of oral drug administration. Now coming to the disadvantage or limitation, limited absorption of some drug. There are so many drugs which chemical constituents are variable. Few of them are less water soluble, few of them are rapidly soluble, and few of them are freely soluble, that means water soluble. So depending upon the solubility nature of drug, the selection of route of drug administration as an oral drug, that may be variable or that may be dependable on the drug to drug. So there are few drugs which are not absorbed via this route of administration. Second one, food may affect absorption. Suppose I have taken a heavy meal or meal containing some fat, some citric acid or any other type of vitamin C containing food. So that food which I have taken as a part of my breakfast, lunch or dinner, then after I have taken any kind of drug or tablet or capsule via oral route, that drug may be affected by the food present in my stomach. So that particular food can affect the absorption of that particular drug which I have taken after taking meal. Next one is patient consciousness is very necessary. If any patient want to take a drug via oral route of administration, then he or she must accept that drug and swallow that drug. But if the patient is in unconscious state like coma or any other condition, how we can administer that drug via oral route of administration? So that is not possible for those patients who are unconscious. So consciousness is very necessary. Next one, drug may be metabolized before systemic absorption. If we give any drug like tablet, capsule, that will reach to the stomach. After reaching to the stomach, with the help of different fluid present in stomach, that may get disintegrated. Disintegration means breaking down of tablet into small particle. After disintegration, that will go for dissolution. Dissolution means a completely disappearance of the drug in the fluid present in the stomach. Then after it will move for the small intestine. From there it will get absorbed. So there are so many barrier, we can say, like metabolism, and this metabolism can affect the amount or percent or bioavailability of drug that will reach the systemic circulation. So that is a hampering effect by metabolizing the any drug. Now next thing is that we cannot take this kind of drug if patient is continuously vomiting. I have not included this point in this table, but I will explain you. If someone is continuously vomiting due to any problem, psychological effect, migraine, or any poisonous effect, then how it will be act? We can give the oral route of drug administration, but just after that he will or she will vomit it out. So that will be none of our use. Coming to the next route of drug administration, that is intravenous route. That means a drug will directly administer to the blood via vein. That is called intravenous route. What are the basic advantage? The absorption is not required. That means the drug will completely absorb directly. That will not need to conversion from one form to another form. That will does not require initial metabolism. That will completely absorb initially, rapidly, as such directly after giving the drug. Now second point said no first pass metabolism. What is the meaning of first pass metabolism? The first pass metabolism means whenever we give any drug or any dosage form via oral route of drug administration, after reaching to the stomach, that will go for the metabolism via portal vein. In metabolism, the metabolite may be inactive, and that is called first pass metabolism, where drug reach to the liver side for the metabolism first, then for their proper action. So in this case of intravenous, there is no chance of first pass metabolism. I should repeat it again. The first pass metabolism only take place via oral route of drug administration. Apart from that oral route, there are no any other route of drug administration at which first pass metabolism take place. Next advantage, say immediate response, suitable for the large dose as an infusion. If any patient is very serious condition, some specific trauma has happened, then we cannot give him or her to oral route of drug administration, because it will take time, approx 10 to 15 minutes depending upon the drug to drug. It will take 10 to 15 minutes minimum. So this is not effective in that case. So we need fast action. So whenever we give the drug via intravenous route, that will act immediately. This is a major advantage of this route of drug administration. And it is suitable for the large dose infusion also. Have you ever applied drip on yourself? Or have you seen any person hospitalized taking a drip as of glucose or any other drug? So it is possible only in this route of drug administration. We cannot give that liquid via oral route of administration because it will not be acceptable for that particular patient. Next advantage says valuable in emergency and can be used in unconscious patient. If case is very serious, if the case required emergency treatment, so we can give immediate effect by introducing the drug via intravenous route. And it is also useful for the patient who is unconscious or who is not supporting. If patient is unconscious, he cannot swallow the drug via oral route, but we can give drug via intravenous. Just we have to do is inject the drug into the vein of that particular person. So these were some advantage. Now let's discuss about the disadvantage or limitation. The first limitation says not suitable for the oily substance. Those drug or those substance which are solubilized in oily vehicle are not suitable for the intravenous route. This is important one. Second, bolus injection may result in adverse effect. If we introduce a large amount of drug via this route, that may cause some unwanted or adverse effect that is not suitable for that particular person. Now next disadvantage or limitation says trained person is required and cannot be reversed once injected. In case of oral route of drug administration, me, you or anyone can take it easily without need any training. But I am not sure that whether you are able to give injection via this route or not. But I am not able to do that. I do not have any training to inject any drug via IV route. So there is required of any person who have trained for this particular route of drug administration and who have complete knowledge about the safety guideline with this route of administration. So that is a major limitation. That is why we most of the case require tablet in place of intravenous injection. Next limitation says strict antiseptic needle is required. This is one of the most important parameter or point which we should keep in mind at every time whenever we are giving injection to any patient. We should not use any single needle to more than one person. We have to change each needle while giving the drug to any other person. That is very important to avoid different contaminant disease, some transmitted disease. That is very important to keep this thing in mind. Next route of drug administration is subcutaneous route. If we apply the drug via subcutaneous part, that is considered as a subcutaneous route. The advantage of this route are suitable for the slow release drug. Those drug from which you want that the drug should release slowly, then we can give that drug via this route of drug administration. The next advantage said ideal for some poorly soluble drug. If drug is not properly soluble in different solvent, then we can go for the subcutaneous route. The few disadvantages are pain or necrosis if drug is irritating. If the drug which we are going to introduce via subcutaneous route is irritating in nature, then it may cause pain or necrosis, that means cell death. Next one is not suitable for large volume drug. We cannot induce large volume drug via this route of drug administration. Now coming to the next route, that is intramuscular. That means we have to introduce the drug into muscle, deltoid muscle specifically. What are the basic advantage? Suitable if drug volume is moderate. Not too small, not too large. If the drug quantity is moderate, then we can go for this route of drug administration. Next advantage say suitable for oily vehicle and some irritative substance. Those drugs which are dissolved in oily vehicle can be given by this intramuscular route, and for those drugs also which are irritative in nature, but not for all, only for some cases. Next advantage says preferable to intravenous if patient must self administration. If you are going to take injection by yourself, then you can go for this intramuscular route, and that is easy as compared to the intravenous route of drug administration. But it is also having some disadvantage or limitation. These are firstly can be painful. Intramuscular injection are mostly painful. In case of tetanus or in case of any other drug, you will feel a severe pain. Next, can cause intramuscular hemorrhage in case of anticoagulant therapy. If we are already having anticoagulant therapy or taken anticoagulant drug, then intramuscular hemorrhage may be caused just because of this intramuscular route of drug administration. Next limitation says sometimes cause inflammation which become painful. If some drug like tetanus injection can given with this route of drug administration, that may cause inflammation, and sometimes that inflammation comes with a painful perception. Next route of drug administration is transdermal patches, that has to be given by the skin with the patches form. So the advantage are bypass first pass metabolism. As I've already told you, any drug which is not included under the oral route of drug administration will completely bypass the first pass effect. Second one is convenient and painless. It is so convenient, no need to swallow it, no need to inject, no need to wear any kind of pricking pain of any needle. Just stick that particular patches and just forget it out. So this is convenient and painless. Next advantage says ideal for drug which are lipophilic and have poor oral bioavailability. If any drug is not suitable via oral route of drug administration just because of this lipophilicity or poor oral bioavailability, then we have to go for the transdermal patches. Next advantage said ideal for drug that require quickly elimination from the body. If you think that drug has to be removed from your body, then this drug will be help you out, because you have to just peel it out and that will be completely eliminated from your body. The basic disadvantage or limitation of this route of drug administration are as follows. Some patients are allergic to transdermal patches and cause irritation. There are few drugs, I forgot that the name of that particular drug, which are used for the treatment of swelling of cheek. So in that case, belladonna, I think, in this case we can feel irritation, and that has a limitation of this transdermal patches. Next one say drug must be highly lipophilic. Those drugs which are to be used in transdermal patches should be lipid soluble. Next limitation say many cause delayed delivery of drug due to pharmacological site of action. Those drugs which are given through transdermal patches may respond little bit later because of delay in their delivery, because of so many pharmacological point of view or their delivery barrier, etc. Next disadvantage, limited to drug that can taken in a small daily dose. We cannot give any large amount of drug via this route of administration, so it is completely or restricted with a small dose or small daily dose, we can say. This is the diagram of transdermal patches, as I can explain you different parts of that. So the first one is drug reservoir, where drug will be kept, and this is drug. The drug will be kept inside this reservoir so that it may release after applying these patches on the skin. So the outermost layer will protect the release of this drug via this direction. This will not allow the drug to leach out. The next is porous membrane. The color of blue represents the porous membrane from where the drug will move slowly, and just beneath of that there is adhesive that will stick to the skin, and the last layer is thin layer. This is called line, which has to be removed prior to the use of the patches. So these three are different layers of the drug, and the drug will diffuse slowly from their reservoir, and this diffusion will reach to the skin where it is applied. So these are the basic diagram of transdermal patches. Next route of drug administration is a rectal route of administration. The route is not suitable for many of the people, and many people get hesitate to use this route as a drug administration. Whenever we place any suppository towards the body cavity like rectal or vaginal, that is considered as a suppository. But we have to discuss about the rectal route of drug administration. This route will partially bypass first pass metabolism and cannot be destructed by gastric acid because it is not giving through the oral route and it will not reach to the GIT or stomach. So this is safer from gastric acid and ideal if the drug cause vomiting. This can be given if the drug is causing vomiting. Next, ideal for patient who are vomiting. If patient is continuously vomiting, he or she may vomit out the drug. That is why this route of drug administration will be beneficial, because vomiting will not affect the action of this drug via this route of drug administration. There are some disadvantage or can say limitation. These are drug may irritate the rectal mucosa. Few drug can irritate the rectal mucosa. Next, not a well accepted route. Many people will not accept this route to introduce any drug because of common and social issues. Next disadvantage, people face difficulty to take drug via this route. It is very difficult to introduce the drug via this route of drug administration, and it is very difficult to do it by self-medication. Next route of drug administration is inhalation. This is fast acting route of drug administration. There are so many advantages of this route. These are: absorption is rapid. The absorption will be faster because the drug will directly reach to the systemic circulation via the transfer of gases form, so that will give immediate effect. Next one, ideal for gases like general anesthetic. This route of drug administration is limited to gases only, like general anesthetic, chloroform, and etc. Next one is effective for patient for respiratory problem. If someone is having respiratory problem like some infection in the lungs, so that we can give the drug directly to the lungs via inhalation route. There are few researches are going on to treat the tuberculosis problem via this inhalation route. Next one says dose can be titrated and localized effect of the drug can be achieved on a titrated dose. If you want to deliver the drug to the particular target, to the particular site of action, then this route of drug administration will be help you out. Next one is fewer side effect. This drug has having fewer side effect, and the limitation says most addicted route. Many people can be addicted via this route of drug administration because this drug enter the brain quickly. Second, uncommon. This is limited for only few drugs which are volatile in nature. So some patient will feel difficulty by this route of drug administration. The drug should be in the form of gas or volatile in nature, as I discussed you just now. Self-administration may be difficult for the large dose, and fewer drugs are available for this route of drug administration. Dose quantity may also be variable because it is difficult to measure or titrate the dose via this route of drug administration. Next route is sublingual. Whenever we place the drug or tablet just below the tongue, that is called sublingual route of drug administration. The advantage says this will bypass the first pass effect. This will also bypass the destruction by gastric acid. The gastric acid will not destroy it. Whenever we place the drug under the tongue will release some saliva, and the saliva make paste, and the arteries and veins below the tongue will absorb this drug very fastly. Next, may cause immediate pharmacological effect, like trinitroglycerin will give you immediate effect in case of angina pectoris pain. There are basic limitation of this route of drug administration, and these are limited to certain types of drug only. As I said, you trinitroglycerin can be given by this route of administration to achieve the faster effect, but not paracetamol, not nimesulide, not chloroquine, etc. Limited to the drug that can be taken in small dose. Only those drugs which can be taken in a small dose will be given via this route of administration. Next disadvantage, may lose part of the drug if swallowed. If someone will swallow the drug, then the effect of drug will be reduced. Next route of drug administration is vaginal. The vaginal route is very uncommon and very hesitative for the many of the women. So the effect of vaginal route of drug administration will be localized, and it is also having some advantage, and this will bypass the first pass metabolism, bypass the destruction by gastric acid, may cause immediate pharmacological effect like local effect like abortion or any other site specific effect to treat the infection, vaginal infection, to cause abortion. We can use this route of drug administration. But apart from this advantage, it is also having fewer unwanted effect and some limitation. These are, it is not acceptable in many of the population. No one is ready to accept this route of drug administration because it is vaginal and it is very shy for the many of the people. Next is confusion and error in identification that is drug for oral or for vaginal route. In many village people, it is very difficult to make them remember that drug has not to be swallowed by oral route, that has to be placed inside the vaginal, because they forget that instruction and they may take it orally because it looks like capsule. So that is a major problem in these cases. That is limited to the local effect only. We cannot get systemic effect many of the time. Next disadvantage is not all drug comes in this form or for this route of drug administration. Only those drugs which are meant for vaginal route can be given by this route of administration. The last one is ophthalmic. That means suitable for the local effect, and it is not having any first pass effect. It is good or target specific to change the size of pupil. If you want to effect of the drug in a particular eyes, then we can go for this route of administration. It is also having some disadvantage or limitation like chances of being contaminated. If you touch the tip of that particular drop of eye drop, that will be get contaminated. You have to use particular drug in a specific limit of time, otherwise the contamination will destroy that particular eye drop. Next, dose measurement and self administration is very difficult. I am not saying this is impossible, but that will be difficult. If doctor has suggested you to put few drop, 1 to 2 drop, it is not exactly possible to place 1 to 2 drop, because few drop of the eye drop will get away from your eyes, and sometime it will more than 2 to 3 drop. So this is difficult. So friend, that's all for today. Thank you very much for watching and listening this video. You can download this note as a PDF. You no need to do anything. Just go for the description box and click the link. The note will be yours. Thank you.